All right, I know everybody's ready for this today. All right, so thank you for playing along. We're continuing our adventure theme. So we all picked an adventure, so you'll see the rest of the guys come up. So yeah, we'll get started. I'm your host, Annie Oakley. I will get us going on our Q2 employee forums and give you an update on our management action plan. And then the rest of the guys will get up here and go through the details. I did not bring the clicker. Will you click it for me from there? Perfect. So I'm going to just highlight the management action plan. You've seen this before. I'll go into a few details, but everything that we're going to go through today ties back into the management action plan. And so just want to reiterate that as we go through all of the tactics, all of the goals, they all relate back to our management action plan and the annual goals that we're working for. We're actually working on fiscal year 27 through 29 right now and putting that together. So this is fiscal year 26. JD is going to go over Plaintree and where we are with that. We're getting really close to bronze. Dick is going to go over our most recent employee engagement survey. So thank you so much to those who took that. We're going to take that feedback and we're going to develop our management action plan goals on the feedback we received from that. So Dick will go into details. Excuse me, it's Buffalo Bill. So sorry. Yeah. The Seedling Center expansion, that is underway. Everything's approved. Construction hasn't started. It'll be about 6 months once it does start. So hopefully end of this year, our daycare will be up to 70 kids that we can take. So really positive there. And we'll have to staff it. So if you know anybody that wants to work there, please let us know. And then on to Care for the Basin. Keith's going to go into some things we're working on transfer reduction plan and some tactics we've done there. And then the scorecard, you'll see where we're trending on a few of these metrics. And then Connect the Basin, market share, providers recruited, and then our net promoter score. So one of the things that we did here around engagement was our community perception survey. Dora the Explorer will come up later and give us details on the feedback we received from the community on that and next steps and building that into our management action plan as well. All right, so here's our scorecard. Again, Q1, Q2, we just finished up. Employee turnover, most of our baseline is where we ended fiscal year 25, so trying to improve from prior year. Dick, gosh, I did it again. Buffalo Bill. We'll get into our employee turnover that ended for calendar year 25 and how we related to national statistics there. But trending in the right direction. Provider turnover, we did have some retirements and a few others, but trending better than we did last year so far. Employee engagement score, we improved from 3.78 to close to 4, and that was from 2022. 1 bronze certification remaining. And then the last metric is how long it takes us to get somebody hired from when we post a position. So we've been monitoring that to make sure that when we're getting posted, how long is it taking us to get hired, and digging into what's causing that, if there are delays and we need to do something different. All right, Care for the Basin, quality. We've been trying to reduce our diversion hours. Last year we had 1,200. This year so far through Q2 we had 0. We did have a few, 12 hours I believe in Q3, or is that Q3 that started that. But doing really well there, so thank you so much to the CCU and ACU team that's been helping with that. HCAPs are not available yet. We'll provide those next time. And then OR and block utilization trending in the right direction. That's been a big initiative of ours this year to keep our ORs as full as possible and utilizing our block time as efficiently as possible. And then transfer out data. Again, that kind of relates back to diversion and some other items, but trying to keep folks here that are appropriate to be in Cody. So we've been monitoring that and by reason code. One of the things that we've done is Eric and his team have MRI coverage at least every other weekend now and moving towards every weekend. So that was one of the big reasons we were transferring folks out is they needed MRIs. So it's really been a team effort. So thank you to everyone that's helped with that. And then last, the community perception. So, all right. Well, JD, I think yours is it. No, Buffalo Bill. Who's next? All right.
If I had a goatee, just so you can get the full effect, but it keeps falling off. I could talk and hold it, maybe, but anyway. All right. So we're going to talk about our employee engagement survey results. You may recall you participated in an employee engagement survey back in November. And we received those results, and we wanted to share those with you. So our overall engagement survey turned out to be 3.97. Now that's on a scale of 1 to 5, so a score that's close to 4. We were very pleased about that. And that is a 1.19 improvement from our 2022 survey. So the last time we had an employee engagement survey was back in 2022. So we improved from that survey score. The highest performing items that we had on the survey was your perception, our perception of how we care for our patients. And you felt like we care for our patients compassionately and clinically very strong. So when you think about what our mission is as an organization as it relates to patients and why we're here, it was very encouraging that we feel like the kind of care we provide our patients is high quality and high compassion. So that was very encouraging. Our lowest performing items were in the area of cultural diversity and inclusivity. And so we will be focusing on that a little bit. Now the key drivers are unique to a hospital. They are unique to an employee group. The key drivers, the survey has a way of identifying what's most important to you as employees. And what you told us is the most important thing is safety for yourself as an employee and also safety for our patients. You also said that trust in the workplace is very important to you, and also having some respect. Respect is a very important key driver for Cody Regional Health employees, and confidence in leadership, and also career development. So our next steps is the department directors will be sharing the individual department, your department survey results, as well as the overall hospital results. Now, the department results are put together exactly like the overall hospital results. So for your department, your highest performing items, your lowest performing items, your key drivers of what's important to you are going to be unique to your department, and they may be different than the hospital's overall results. And then the directors are going to meet with their senior leaders and develop action plans to try to improve the results and respond to the results of your department survey. And then senior leadership will be doing the same thing. We're focusing on the overall hospital results. So do you have the clicker still? Okay. So I wanted to talk a little bit about engagement though. And I was thinking about what did Buffalo Bill do to improve engagement and retention for his employees? And this thing called ChatGPT came up with some stuff. So it said that some of the things that Buffalo Bill tried to focus on, remember he had his Wild West show, which was hugely successful back in the time. And he turned work into a spectacle. Every job felt like part of the Wild West show. You weren't just an employee, you were a headliner. When people feel proud of the story they're part of, they stick around. I thought that was real relevant to some of our survey results, because another thing you told us is that you're very proud to work for this organization, and you would recommend this organization to friends and coworkers. So you apparently do feel part of something larger that you're proud of in Cody Regional Health. Public praise and big energy. Buffalo Bill loved a dramatic introduction. Employees would get shout outs in front of the crowd. He would introduce Annie Oakley as the fastest sharpshooter west of the Mississippi. Those are some of the things we try to do with our Living in Mission Awards, our Service Award banquet that's coming up here in February. That is publicly recognizing our employees. Clear roles and clear glory. Everyone knew their part. Scout, rider, sharpshooter, performer. No vague job descriptions, clearly reduced frustration and mutiny. And he knew that morale was fragile. When performers left, he noticed. With stars like Annie Oakley, he treated them like stars. His retention strategy was value your top talent. And finally, Buffalo Bill retained employees by turning a job into an identity, praising loudly, and making sure everyone felt like part of something bigger than themselves. So as we are building our action plans to respond to our employee engagement survey results, we can take a page out of Buffalo Bill's engagement strategies. So now we're going to talk about turnover. I look confused there for a second. Just looking for someone to give me a cue. All right. All right, turnover statistics. So these are our turnover statistics. Now, why is turnover important to us? Because there is a direct correlation behind high turnover rates for hospitals and poor patient outcomes. So if you're a hospital that has extremely high turnover rates, then you're in this perpetual cycle of hiring, onboarding, training, and potentially increased traveler utilization, which has negative impacts on patient outcomes. So turnover rates are very important, so this is something we monitor. So our turnover rate for 2025 turned out to be 16.3%. The national healthcare average turnover rate for hospitals was 19.6, so we are over 3 points better than the national average for turnover. The RN turnover rate was 8.5% compared against a national average of 16.4. That's largely due to Indiana Jones over here and some of the strategies he deploys. And then our turnover rate for CNAs was only 22.2% against a national average of 41.8%. We actually see turnover rates nationally as high as 60 and 70% because it's a super tough position. So our turnover rate, we're very proud of that. And then you can compare our turnover rates for 2025 against what they were in 2024, and they improved on all categories. So, what's next? JD, all right.
Thank you very much, and I am dressed like the adult in the room, so you're welcome. Somebody has to keep everybody straight in here. It's a sad day when I'm that person. So I just want to introduce to you sort of our big initiative for Plaintree this year, and I want to harken back to the employee engagement and what employees said they valued in that engagement score. They talked a lot about trust and communication and care and feeling valued in their position. And really, that's what Plaintree is all about. Plaintree is all about caring for you as the employee and for our community as people and not just dollar signs or numbers or warm bodies in a position. And so my whole position is making sure that everyone feels valued and welcomed and making sure that we have a strong culture in our organization. I think we do have a great culture, but I'm reminded of a great gal who you may have seen in orientation, Rosie Bartel. In her video, she likes to say, we're never going to be perfect, but we can strive for perfection. And our culture is fantastic, but it can get better. And so in 2026, this is our big Plaintree initiative. It's called the Plaintree Champions. And Plaintree Champions are individuals who are designated within a department to promote and spread the Plaintree philosophy and training. I can't be everywhere. I'm a big guy, I'm loud, I get that. I love chatting with everybody, probably chat with you a little bit too much. I apologize if I'm pulling you from your job, but I can't be everywhere. And so this is a great opportunity for you to have people in your department who are great advocates for patient care, for our community, but also who really get along with their coworkers and care about the people around them. They get to step up and they can share Plaintree news and trainings and initiatives with you so that I don't have to hop around from department to department, so you don't have a stranger coming in saying, hey, this is what we should do. You have people in your department cheering you on and sharing that message. So Plaintree Champions are volunteers who excel at person-centered care. They're people who really treat people kind and who care about them, not just in the community, but within your department as well. They're people who care about the culture of their department and the hospital. These are people who genuinely want to see us as a group succeed. Because when we all are moving in the same direction, when we're doing a great job as an organization, that means that our community is being served as best as we can. And that's what our community deserves. And then lastly, they're trainers who are comfortable sharing the organizational updates with their team. Now, I wrote this, so shame on me. I really don't like that word trainers. And here's why. Plaintree Champions, you don't have to be a great public speaker. You don't have to stand in front of people and espouse on the wonders of empathy or some other training topic or customer service skills. You don't have to be that person. All I'm asking for the Plaintree Champions to do is to share the news that I am sharing monthly in our newsletter, share the training emails, just highlight those things in your department. I understand we're all busy. I understand we get 1 million emails a day, and sometimes mine is just another one on top of that. Plaintree Champions, it's a great opportunity for you to take a pause in your staff meeting and say, oh, by the way, JD sent out some news updates, or Plaintree had this great thing happen and I think it applies in this way. That's all we're asking for. So if you're interested in becoming a Plaintree Champion in your department, please find me, let me know, bug your manager, supervisor, director, let them know. We're looking for people in the department to cheer on that initiative. Your director or supervisor or manager may also be coming to you and asking you about that. I see some of you in here who have already been signed up. And so I'm excited to be working with you. We're gonna really kick that off in March. And then the next thing I wanna talk about is where we're at with the Journey to Bronze. You've been hearing about that for a year now. And guess what? We have applied for our certification through Plaintree International. We filled out the paperwork, we signed it, got the official stamp, sent it out, and this is the process that we're in. So from February to April, around in there, Plaintree International is going to review our progress and plan to visit our organization. We've got to send paperwork. We've got to prove we've been doing what we've been doing in the back end, so they get our policies, our procedures. They sort of understand from afar what we've been doing, and then they're going to visit. So around April, May time, Plaintree International is going to fly out with a team to survey our organization. And this is an awesome opportunity for us. This isn't a survey where they're looking to ding us and they're looking to be critical and say, hey, this is where you're deficient. This is a survey that they come out and they partner with us and they say, hey, you're doing a great job in this. Here's some opportunities for growth in this. And we're hoping that by June, July area, after they've flown back and they're talking about us and behind closed doors, we're hoping that they will come back with a recommendation to award us our bronze certification. We're right there. We have one driver, which are kind of our check marks for bronze certification left, and that was really the action plan based on the employee engagement, and we're already doing that. So we've checked all of the boxes. We're working hard. The organization is in a strong place with that. So we're pretty positive that that's going to happen. So thanks, folks. And we have somebody who was lost to time and has now come back.
So you guys probably heard I was lost over some ocean somewhere. That's actually a myth. The Wright brothers were after me for stealing their thunder as the darling of flight. And so I went into witness protection right here in the Bighorn Basin. And if you ever want to learn more about me and you're in Meeteetse, stop at the little museum there and you'll get a lot of information about my connection to the Bighorn Basin. Anyway, I'm here today to talk with you about our financial status through our first 6 months of the fiscal year. So as of December 31st, I don't know, does this have a place? No? Okay. Anyway, we budgeted for a 0.3% operating income, and operating income is the results of your patient-generated revenue less your patient-related expenses. So anything that goes into the care that we provide in the hospital is considered operating income or expenses. So through December, we have an operating margin of 1.2% on our budget of 0.3. So we're standing in a very good position through the first 6 months of the year. Those items that are below are called non-operating. So it's things like investments, our property tax funds that we receive, grants that we might receive, those kinds of things that aren't directly related to operations. And you can see through the first 6 months, we're $4 million above budget. So far we're in really good shape, but I would caution you, not to lose your minds in the next couple of months, because typically the winter months are slow for us historically, and we do occasionally incur losses over those months. But our trend has also been to make that up in the spring once things start back up. So that's the update so far. I also wanted to highlight the incredible contribution that the board has made to making sure that you have equipment that you need to do your jobs. So typically our capital budget is like $5 to $7 million a year. This year it's 16 million. So it was really important to the board that we invest in this organization and the equipment that you guys need to do your jobs well. So these are the big projects that carried over from fiscal year 25. Most of these are either in progress or complete at this point in time. And then this page represents the about $7 million worth of additional capital requests that we added to what was on the first page. And we asked our directors to kind of stagger their purchases in quarters so that everybody wasn't trying to buy everything at one time. So far through December, we've purchased almost half of the things that we budgeted for this year. So anyway, I just wanted to highlight for you the dedication that the board has to making sure that you all have what you need. And that's it for me. Where's Waldo?
I'm here. All right, this is the fun part. We get to celebrate people. So we have some new providers that have come on board. Kate Carter in pediatrics, Lane Lash in OBGYN and internal medicine, Jill Mayhew with Yellowstone Sports Medicine, Julie Stewart is a new NP hospitalist, and Juliana Papez is also with OBGYN, and Alyssa Whitlock with OBGYN. So we're excited to have them. If you see them in the halls anywhere, just yell at them in a really cheerful voice and say, welcome aboard, and then look at them awkwardly. New leadership, same thing with them. Same rule applies. If you see them in the hall, give them a big hug and say, welcome, we're glad you're in that role, and then look at them very awkwardly. Lance Arnold, clinical supervisor, surgical services. Sharon Rumfield, practice manager, clinic administration. Rajon Davis, clinical supervisor, surgical services. Katie French, accounting director. Lacey Taylor, manager, PFS. So give them a round of applause. We're excited. And I believe Dora has a few things to explore with you.
I brought Boots with me today. He does talk from time to time, so the front row may hear it. But he's here because he loves the topic I'm about to go into, as do I. So anybody remember taking the perception survey? It went out in the community about 3-4 months ago. Anybody? Takers? I say, okay, thank you, I see a few. So what we did is we inquired with the community. What do you think about Cody Regional Health? The services, the people, just everything in general. And this is what we learned. So the purpose was to capture their honest feedback to us. We had almost 800 respondents, which is great. Really, that's a very, very robust sample size that tells us exactly what we want to hear with statistical significance. 92% received their care here at Cody Regional Health, and then 60% lived in our primary zip code, which means 40% lived in our secondary, which is also, I think, really important because we got to hear a very diverse group tell us about our services. So we should be very, very proud of the things that we do here. And here's what the stats tell us. 86% who responded said, we have excellent or good care. 85 said they're satisfied or very satisfied with us. 87 recommends us to friends and family. I love this one because if you go to a restaurant, if you go to a doctor, if you go anywhere and you like the experience, you always tell somebody, right? So 87% said that they would recommend us. 74 feel very or extremely confident in our providers. And then nearly 60% feel heard and respected. Now, that's a little bit lower than the other stats that I shared with you. However, when we intertwine Plaintree into our facility, as JD's talking about, and we improve on that path, I would anticipate that number can go up. So, moral of the story, we have high trust and high quality care through the eyes of our community, which is great. But what are some of the areas that they said that we're strongest at? They said we have skilled and compassionate providers. They said they have great relationships with the APPs and our physicians providing the care, positive experiences across many departments, and also a deep appreciation for the services that we provide. We know in rural medicine, sometimes it's hard to offer robust services. Thankfully, our organization does that, but the community also sees it and appreciates it. Moving on to areas of potential improvement. So what did they say to us? They said they can see communication gaps. Healthcare is hard, that happens, right? Whether it's imaging to lab, lab to the floor to the ED to the clinics, there can be breakdowns in communication, and our patients can see it from time to time. Billing, man, anybody great at billing? I'm not sure. I'm not sure anybody really is, but that's one of the areas the community said that they thought we could improve upon as well. So billing confusion, cost transparency, and early collections. Access challenges and appointment delays is also an area of focus that they highlighted for us. So the clinics do work really hard to create access for our patients, but when you have limited services sometimes, or limited providers, it can be a little bit of an uphill battle, but certainly something we do pay attention to and appreciate them mentioning to us. Specialty shortages, right? We offer great services, but we still don't have certain specialties, physicians, or clinicians available. So they've noticed that as well. In addition, we sort of got mixed emergency department feedback. We had some really great feedback saying we're amazing, and then we had some not so great feedback. So how do we improve that overall perception of the emergency department for our community? After that, workforce instability and traveler reliance. Okay, who finds it interesting that the community knew the word traveler? I sure did, which means it's in the news, it's out in the community, it's just out in the world a little bit more over the past couple of years. So that's something when we talk about retention, when we talk about Plaintree, hopefully we can improve upon some of that and change that perception as well. So it's not a quality problem, which is great news. That's significantly harder to overcome through the eyes of a community. It's a consistency in process or system problem that we can work on. So how do we take that information that you just heard and start to put it into actionable items? So here are the 5 items that we've identified based upon the feedback that we're gonna focus on. Number 1, improve billing clarity, accuracy, and financial communication, right? Now, PFS is working really hard at this. Jess is brainstorming ideas. I would anticipate seeing some action around those items in the next few months. Strengthen communication across the entire care journey. I really think we're gonna lean on Plaintree for this one, right? As we all get a little bit better in person-centered care, we can start to work towards communication. So I anticipate this one coming online with JD's support. Recruit and retain high-demand specialty providers. Whew, I tell you, I'm working really hard on that one. I spend a significant amount of my time trying to find amazing clinicians that we can bring into this organization. It's certainly one of my top priorities every single day. Stabilize staffing and reduce reliance on travelers. There's that word again, right? So when we talk about the action items from the employee engagement survey, hopefully we can have a little less turnover. We're on the right trajectory already, but this is an area that I think we can start to change as well, which is all really good news, right? We're already working on a bulk of these items. And then the last one is improve emergency department communication and experience. I know Danielle is working really hard on this. She's gonna sort of tackle this with Keith as well as marketing and get support from others to figure out how we can go about changing that perception in the community. So again, why take a survey, right? Why ask the community to give us feedback if we're not gonna use it? So we are making a commitment to make changes. There was also items in the survey that I didn't necessarily meant, but are super important that are pertain to the marketing that we do in the outreach in our community. So they, meaning the community, they want more information and transparency around our services. They didn't say they had a great understanding of everything we do. Now that's a challenge in itself because we offer so much, but certainly gonna work towards it. They also said they prefer email, text, and social media communication. But anybody seen a billboard recently that we have? Or a newspaper, right, ad? Or maybe heard us on the radio? We still do that, but we're going to start to do more electronically because that's how they said, the community said they want us to talk to them. After that, they also mentioned being in the community. They want to see us visible. And I think that's really important. Today, at 12 o'clock, right after this, I'm gonna go to the Rotary Club because Alyssa Zantello is presenting on what a walk-in is and the services that we offer. That's the things that we need to start doing, getting our clinicians out in the community, but they also talked about leadership. So we'll be enlisting the help of other individuals in the room so that we can become a little bit more visible in our community.
Are you changing before you go?
I'm definitely changing before I go. I would get a lot of weird questions. And then after that is the operational side that we already just talked about. So again, we're making a commitment to use the information to change. And I think that's what we need to do when we take or accept feedback from the community, or like the employee engagement survey. So we're gonna listen, we're gonna act, and we're gonna communicate our progress. And if we can, we're gonna communicate it publicly to the community, because that's how we show them that we heard them. So really excited to see where this goes in the next few months, but I do believe you'll start to see some movement in that area. Well, I'm gonna invite Indiana Jones to come on up and help me with the next few slides. I'll start and then Indy will take over. Talking about recruitment, right? I said I work really hard every single day to try and find us great clinicians. But here are some of our open searches. We have a lot. And if you saw Hannah's first slide about our metrics, we'd hired 0 in the first quarter, 3 in the second, and our goal overall is 10. We still have quite a few open positions, but we also have probably 5, let's see, 1, 2, 3, 4, 6 coming in this quarter. So starting to hit that home stretch, and hopefully we'll hit our goal. But we have OBGYN, cardiology, medical oncology, radiation oncology, orthopedic surgery, medical oncology advanced practice provider, wound care advanced practice provider, as well as the hospitalist, nocturnist position for a nurse practitioner. And then we previously had a nurse midwife position, but because we're focusing more on a physician for OBGYN, we're placing that one currently on hold.
Well, good morning, everybody. So, as Dora mentioned, we got some providers coming on board with Cody Regional Health. So Dr. Thomas Etter, a general surgeon who's been in private practice in the community for a number of years. Some of you remember Dr. Etter when he was employed by Cody Regional Health when he first came here. He's going to come back under Cody Regional Health. He'll be working with Dr. Rebecca Deal in the general surgery clinic in the Cathcart building, so there'll be a joint force working towards that.
He's talking.
I know.
He's excited about
He's very excited about this, so we're excited about this too. It'd be a great team. They've been working together already with doing some more complex cases, and so I think it just brings that general surgery clinic together and a collaborative effort. Anesthesia. So anesthesia's been like searching for the lost ark a bit, you know, and some of you remember May of 2024, the group that was here for several years decided to dissolve, and so Cody Regional Health had a choice to make whether to contract with a group to provide anesthesia services here or to employ anesthesia providers. And we chose, along with the board, to do an employed model of anesthesia providers. And so we started that in October 1st of 2024, and I'm happy to say that as things are on track, in May of this year, we will have a full anesthesia group. So some of those providers joining us, as you know, Dr. Johnson, he's our medical director. He came in February of 2025, so he's been here for a year. And if you know him, he's like Mr. Plaintree. He does a great job with our service and with our patients and with our surgical crew. He's leading our efforts. Dr. Chris Sufferin will be joining us in a month, March 9th, as one of our anesthesiologists employed. Comes from Arizona, been in practice now out of residency for 7 to 8 years. Interviewed here before the holidays and offered and accepted. So we're really excited to have him on board. He seems very positive anesthesiologist as well. Chris Black. Chris Black has been working, he used to work under the group here and provided services at Cody Regional Health. He's also been doing some fill-in shifts for us, but his full-time employment has been at the surgery center with an open CRNA position. He's elected to come back to Cody Regional Health and be a full-time CRNA for us. So that will fill our last nurse anesthetist position. And then our last provider is Dr. Laura Pasternak. She'll be joining us in May. Dr. Pasternak comes from Thousand Oaks, California, has 3 small children, husband. They love the West. When this opportunity came open, she jumped right out, and I think she was here interviewing within a matter of 2 weeks and made the trip over the holidays just to be here with her family. And so really excited about her. So that will be our anesthesia team. And then Chesley Williams will be a nocturnist PA. So with our hospitalist service, we've now for probably around 5 years had a telehospitalist service. We are making the switch to bring providers in-house in the form of APPs. And so we will have 24/7 in-house coverage by a provider that works with our other hospitalist on the day shift. And Chesley is coming from Oklahoma, Texas area. Been a PA for a number of years, has worked in Hamilton, Montana for a stint, and seems really personable and loves nights. So she is a night dweller, so you night people will really appreciate her. Dr. Valerie Langfelder is a family practice physician, and she's been in practice for a number of years in Powell and is chosen to come over to Clay Regional Health and will be in our internal medicine practice as a family practice provider seeing adult patients. So excited to have her on board as well. And then, yes.
Thank you. Okay. Keith and I are also going to give you some service line updates. We want to keep you fully informed with some of our important program transitions that are occurring. So wound care, Dr. Manini, he was here for about 35 years in our community, treating patients not only in pulmonary, but also more recently in wound care. He retired at the end of December. We're really, really happy for him. However, it meant that our clinic was going through a little bit of a transition because of that. Dr. Lindsay Ford as well as Dr. Connor Deal stepped in, thankfully, to say that they really wanted to support the wound care program. It's important to the hospital, it's important to the community, and so they are our physician coverage in the clinic as I continue to search for a advanced practice provider for that specialty. Hot off the press, just yesterday, I did extend an on-site visit invitation, so hopefully that individual will be here in the next couple of weeks or month so that they can see the program. Moving down the list, we have the Bighorn Basin Cancer Center. So you probably are all aware that Dr. Reed had stepped down from his medical oncology and medical director position over there. He's headed to Montana to continue his career path, but has John Vipperman. And a lot of us know John because he's been in internal medicine, but he's also been in oncology as well as orthopedics. He has about 15 plus years in medical oncology, and so he's really going to help carry that program forward with the physician coverage that we have secured. So that program will continue to accept new patients and treat our current patients as we have that transition happen in April. In addition, cardiology. So Dr. Gower will be leaving the program here in February. I have secured full physician coverage moving forward starting in March, which will be great. So again, that practice is accepting new patients, but also taking care of our existing patients. That program in itself, as we all know, is extremely important to the organization because it has far-reaching into imaging, into the emergency department, into other clinics, onto the floor with all of the imaging that's required, but also it matches our patient demographics. So our ultimate goal is to have 2 cardiologists full-time here in our community, but let's start back with getting 1 and then we'll work on a second. Keith. Oh, sorry, Indy.
Yes. All right, so since our last employee forums, a new venture has come to be. So EMS expansion into Hot Springs County, Thermopolis occurred in August of 2025. So this was, Hot Springs had a service that was EMT basic, and so they provided that service for a number of years. The hospital approached Philip really to see if we would be interested in coming on board and providing paramedic services to the county. They were interested in a higher level of care. And so we worked with them, and we did bring our services there. So we have a full-time 24/7 crew on in Hot Springs and Thermopolis, just really right outside the hospital there with their living quarters, and provide services there. And it makes sense for us, makes sense for them. We're really becoming regional in our EMS services, so we have, assets in Moreland and Basin that are also in proximity. So it gives some redundancy to, when there's multiple calls, when there's, multi-victim accidents, that sort of thing. And then you add in flight, and we're really able to provide a lot of high-quality services for the Basin, which we're proud of. So kudos to our EMS team. That was a bit of a lift, obviously, when you're taking on a new service and you're having to staff that for a while till you hire the positions and make the transition, but they did an excellent job. First Flight of Wyoming. So First Flight of Wyoming, just a couple updates, just a couple changes. We are moving away from our vendor that we've contracted since we originated with First Flight of Wyoming and moving to Classic's umbrella. They provide billing services. And the reason this makes sense is Classic is the vendor that also provides operational support for our aircraft and the communications center. So it just kind of all moves under that umbrella of Classic. And Classic is also under the umbrella of Intermountain Health, which is 65% owner in this venture. So it just is going to help streamline our billing services and improve our collections for First Flight. as well as the communication services. When we stood up First Flight, we had worked with St. B's to really have a dispatch center. So we did employ really our own dispatch. And so we're now moving that under Classics because they have a big hub of a dispatch center, so that will also save, that's a significant savings for the program. So volumes are increasing in First Flight. Part of what we did with First Flight when we went in to Hot Springs County is we have a first call agreement with them for First Flight to provide their services there, and so that's also helped provide volume and high quality care to Hot Springs County. And then last thing Annie mentioned was that our diversion, we had a big focus this year on reducing our transfers. Part of our transfers occurred when we were on divert, which means we don't have any beds available or we don't have any staff available. The latter is more likely the scenario is staffing. And so I have to give a shout out to the ACU and CCU teams here, and Paula, our director, who's covered, and Susie as well. We had 0 hours of diversion in CCU and ACU for the first 6 months. We've been averaging 1,400 to 1,500 hours of divert and CCU on average annually, and that was a big area of our transfers, so kudos to them for, give them a round of applause if you would, please. Yep. And then with that, we did step down status. We created a step down status, and why this makes sense is we previously had a med-surg status, or acute care we call it, and a critical care status. We have a lot of patients that kind of fit somewhere in between that need a higher level of monitoring, maybe more assessments, a lower staffing ratio. And so we talked about this about a year ago and as part of our initiative to decrease our CCU diversion hours. And we did implement that a few months ago. And so it also aligns our charges with the appropriate care too. It puts those patients in a more appropriate charge status and gives us a status. So that's worked out well. And I'm going to turn it back over to Miss Annie.
Thank you. All right, well, thank you guys all for coming, and thank you so much for all your work, not only this past year, but all of the time, and for participating in all of our surveys and trying to help us be a better organization. We couldn't do it without all of you, so thank you so much. We do have time for questions for me or any of these other characters up here, if you have any, so happy to answer questions. As always, my door's open. If you'd rather meet one-on-one, happy to do that too. But any questions? Any jokes, anything? Okay. All right, well, if nothing else, there's some treats left and drinks, so help yourselves, and I hope you have a good rest of the day.
Miss Slacker. Yeah, you leave me over there. I'm trying to get some.